Yes, I used to live in Michigan, and the program I had was through Medicaid, and it was absolutely horrendous. It was a horrible program. They didn't pay PCAs all that much, and it's a large reason why I moved from Michigan.
Basically, we threw Emily under the bus since she wasn't here. Any problems with this hangout? Don't have a phone.
Yep.
Okay. So we're just going around the room here. We got Don in Georgia. We got Gabriel in Michigan. Joey in Kansas. Margie in lovely New York State. And me here in Brooklyn, also in New York State. Um, so we were just talking, generally about whether people have services or not, and pretty much everybody does, with the exception of Gabriel, who's in the process of getting services. So, given that this is a really unscripted conversation, we could just start out by saying, how's it going with your services, and whether you're happy with the level of care that you're receiving. And the famous Maria Sotnikova has just joined us, also from Georgia. So we got two Georgias. All right.
Carrie Willoughby.
I'm Georgia from Florida. All right. There we go. So this is a real general conversation. Are there any questions that people want to ask about attending care, or personal care, or PA services, or anything?
Right. Right. Questions.
This is Dawn. I think I would like to find out from folks. I live in a rural area in Georgia, and so I struggle being that I am in a rural area and the Medicaid reimbursement rate is so low, finding and keeping reliable caregivers. So I'm just wondering if any of you all live in rural areas and have that low Medicaid reimbursement rate, and how you overcome those barriers in terms of finding and keeping personal caregivers.
Well, it's hard for me to comment on that because I live in about as non a rural area as you can imagine. By New York City standards, my workers are not paid really that great, but we have a lot of hours, so I kind of make up for the low hourly rate with a decent block of time that they put in for it. So, like, typically, the workers receive anywhere from 36 to 60 hours a week. So if they do 3 shifts, they get 36 hours, or if they do 5 shifts, they get 60 hours a week. So it's about $10 an hour. And in New York City, that's a pretty crappy rate, So it sounds like a lot, but in relative terms, it's not,
Right.
I know that Joey's in Kansas, which is kind of more rural than Brooklyn. Any pointers there, Joey?
I live in the suburb of Kansas City, Missouri, so I'm not out in the middle of nowhere. So
Okay.
I don't know. The reimbursement rate here is now not that great either. So it's like a little over $9 an hour before taxes. So it's not that
Okay.
great.
Right. But the cost of living is probably a little lower there than it
A
is
little.
here.
It is a little, but it's still hard for most of my PCAs to make, enough money.
Yeah.
I live in the suburbs in Ohio right now, and well, with the problems. I don't know if a lot of you know the problems I'm going through right now. Those notwithstanding, Ohio has one of the better rates. My PAs make $18 for the first hour and 12 hours every additional hour. And I think the 12 hours is not that great. Honestly, I think that PCA should be making much more money for the kind of work they do. The one thing I like about the New York program is that they offer health care, which I've never heard of any other states offering that. They offer benefits, health care. Those things should be a given for our PCAs because they they work for us. They work a lot of hours. They can't afford to get sick, so this idea of preventative care. We live in a country where it's not about preventative care, it's about going when you get sick. And I think that if we live with this idea about preventative care, then our PCs would go to the doctor, we'd see them get their less, you know.
Right. Well, there's a lot of changes coming down the pike in healthcare. So, like, one of the things that I do with my job, I'm helping to select what type of insurance plan we're going to be offering in the future. And the healthcare expenses that we're looking at are just going through the roof. Right? Like,
Yeah.
we're seeing a 20% increase in our premium for the workers. So it used to be that the insurance was really great, and now unfortunately we're gonna have to kind of scale that back a little bit, and it's not gonna be as good as it was before. And really, this is going on all over the country, so it's not just unique to New York. Health insurance is really exploding, and so unfortunately, I think it's going to get worse before it gets better.
Yeah. So Gabriel said that he has the same problem. He's in a rural area in Michigan, and they only pay between 8.50 and 9.50 an hour. Yeah, that's really the big problem I had when living in Michigan was that my PCAs were working the same amount of hours, and really they got paid like $1,000 in a month. $1,000 to do full time care. That's just ridiculous. That it's
Mhm.
that little, you know. And it's just like very frustrating, you know. And Joey Wilson said that he's from Sacramento, California, and his county pays 10.80 an hour. And sadly, that's really one of the higher amounts we see, $10 or so, you know. Um, yeah, Gabriel, they were only allowed 40 hours in when I lived in Michigan too. In fact, they kept my PAs at 35 hours and told me good luck finding someone who would just take care of me during the rest of the
Yeah.
days.
Well, that's just this to me partly goes back to why we needed the Community Choice Act. These rules about eligibility and what the states provide need to be made sort of on a national basis, so that you can go from state to state and follow a job wherever you want to live, and you don't have this frustration of being stuck in a state. I mean, I would like to live in a warmer climate. The idea of living in like Florida or Texas or something like that, I would consider that if the right job popped up. But not when I lose my camper.
Yeah.
Exactly.
Yeah, I already know that when I move to New York, I'm looking at a couple months where, you know, I just have to have my family care for me completely and do all my hours, which is
Mm-hmm.
going to be stressful, you know, because while Ash does some of my hours, you know, she doesn't do all of them, you know, but just having her do all of them for a couple months, you know, until I get set up, that's frustrating for everyone. And then she can't, you know, work out of the house during that time. Whereas once I'm set up, I hope that she only has to work a certain amount of hours, and then I have other people taking care of me.
So, what do people do for recruitment? What do you guys find to be the best tricks or finding people? I use like a combination of, I use Craigslist and I use word of mouth through my friends, because I've discovered that you really get the best PAs from other friends that will say, hey, I got this guy working for me. He's only doing 2 shifts a week, but he wants to work more hours, and he's really good. You know? And I had this one kid working for me. I met him at a party. He was helping my friend, and he was really, really, really good. And I was like, I gotta hire a guy like that one day, you know? And then, out of the blue, about a year later, I get this phone call, and it's the same guy who I was thinking is a really good PA. And it was really fascinating. He came to me, one of these tough guy New York City kids with like really long braids, and he was a little bit rough around the edges. And within like 3 months, he cut his hair down, did like a buzz cut. He ended up being this great PA for about 2 years. And I encouraged him while he was in college, and then I got him to transfer from a crappy school to a really good school. And we still remain friends to this day. And sorry, I find that getting networking through other disabled friends is one of my best methods.
Yes, that's how I got my other PAs. Is one of my friends who has SMA and lives in Dayton. One of her nurses also does PCA. Um, he knows it's at a lower rate, but he just wants to help, you know, and he's cool with that. So, because he can only have so many nursing hours, he's willing to take on some PCA hours, and that's how I got him, was through her. So.
Mm-hmm.
Hey, it's Margie from New York.
Yeah.
As far as recruiting, I also use Craigslist. Actually, I use Craigslist exclusively. And I've tried the word of mouth thing by finding PAs through other PAs, and that doesn't work so well for me. But I have a lot of success with Craigslist.
Yeah, this is Chris from Grand Rapids, Michigan.
Hi, Chris.
And I use Craigslist a lot. I'm a college professor, so I also put ads up on my campus, and that sometimes works. The thing about Craigslist is that it's exhausting to weed out, people that won't work out. People who just give you a resume without any sort of personal introduction or anything like that. And so I've gotten great aids that way, but I've also gotten some stinkers that way as well,
Right.
Do you guys ever fear that, like, a serial killer? I always hear about, like, the Craigslist serial killers and stuff. I'm always afraid that I will find the one psycho who wants to murder some guy in a wheelchair. So.
Yeah, there's always potential. I always throw on there, must have a good background check and must have a driver's license and things like that. And I hope that sort of scares away anything that might be a freak.
You guys do have to screen people. And
Oh yeah.
when I use Craigslist, I screen them really well. And then the ones that sound really good to me, I refer them to a survey that I created on SurveyMonkey. And I got the idea from someone in this group sometime last year. It's
Atlanta, yeah.
Alana, yeah. it's a great tool. I mean, I put in questions and I ask them to answer, and I learn a lot about them before I even talk to them on the phone.
Wow, that's a great idea. Yeah.
Right now, I'm using an agency, and it's worked out. It's most of the time, but the past 2 years, it's just been really crappy people, one after the other. It's just getting frustrating.
Yeah.
Right.
Yeah. Hey, Craig, where do you teach at? Because I just graduated, and I found that the college that I went to, it was a good place to post for finding someone. Like when I needed someone to help me with eating on campus, I would just post something there, and
I work at a small liberal arts college in Grand Rapids called Calvin College.
Okay.
And yeah.
I actually lived in Michigan until about 5 years ago, but I was closer to Flint. And Gabriel here is in Michigan, but I don't think he said where in Michigan.
Right. I mean, you can go either way with college students. You can get amazing students who are really mature and ready to help and really willing to get the hours. And you have some who do it for a month and then they're like, well, this, I'm not into it anymore. And so, it's a little bit transitional. They're a little bit unpredictable, but sometimes you can find some really great ones.
Yes.
I think when you find a good college kid, it's a great fit. I mean, like, I had 3 that were young kids like that were just the best, great PAs, and I kept in touch with them all these years later, And like you say, when it's good, it's great, but when it's bad, it really goes bad.
Yeah.
The best people I've had are nursing students.
Yeah.
I'm starting at KU, taking classes, and I have a friend that just graduated from the nursing program. He has some connections. He's gonna give people information about working with me.
Yeah.
So hopefully that will work out.
That sounds like a good lead there.
Yeah. I just want to say hi, Max, because Max snuck in while we were, How are you, Max?
Hey, how's it going, guys?
Pretty good.
Good.
And Max is in Oregon, and Max is trying to get out to become independent and have PCAs. So, we were talking about before, Max, like, what kind of PCA systems everybody's under. Maria, you have your own PCAs, don't you?
I do, yeah.
How many hours does everybody have for their care?
I have 56 hours a week. I don't use all of them currently, mostly because I still live at home.
So I have certain ways of filtering out people, right? So then at that point, I've gotten the list way down. I might get 60 calls, and I'm down to maybe 10 people that I want to call back. And I do a preliminary interview on the phone. And I try to be really precise about what I want. And if I'm dealing with somebody that's got no experience, I tell them, you have to help me wipe my ass. And I learned that a long time ago because a guy was like, wait, I have to wipe your ass? Mm-hmm. I'm like, no, I can't do it. That's why I'm hiring people to help me, right? So then he starts arguing with me about the pay rate for wiping my ass. And he's like, well, I'll do it for more, but I won't do it for that price. I'm like, well, this job is obviously not for you, but thank you very much. Have a nice day. He's like, no, wait. Don't you understand? I'm like, dude, why are you on the phone still? I'm telling you, this is not a job for you. come on. And he goes, you gotta understand. And I think, you gotta understand this. Like, so yeah, I use the telephone religiously. Then the third or fourth phase of my thing is the interview, you know. And I personally don't like to use a a written job description, really. I'll give them a schedule in writing, but I find that with a job description, if I've left something out, then potentially they're like, no, I'm not going to do that, or I don't feel comfortable with that. So I keep things kind of really flexible and informal, and so my next phase of the weed out process is the interview itself, and I ask them I try to get them just talking, and I just want to get as much information from them, and I try to avoid questions. Do you have kids? Technically, you're not supposed to ask that type of question, you know. But I ask them, oh, what do you do in your spare time? If they raise that they have kids, then it's okay to talk about it. But you shouldn't really ask them, do you have kids? You know. And then I look at their appearance. If they look neat and tidy, then I'm like, okay, this guy cares about his appearance, so he's more likely to care about my appearance. You know. Now, sometimes I make mistakes where they show up, clean and tidy to an interview, and then when they start showing up to work, they're all like, sweatpants and baggy t-shirts and stuff like that. But very quickly, my team they pick up that I'm going to an office, and they don't want to look too bad themselves, so they rise to the occasion generally. And then it takes me about 3 to 4 weeks of working with them. I give them about 4 to 5 hours of training beforehand before they start. That way I can feel how they lift me. As long as they can lift me, I go forward with it. If I don't feel secure with the lift, that's it right there, Because last year I had a guy who almost dropped me while he was carrying me to the shower, and I'm like, I will never do it again. He was huge. He was like 6'3". He weighed 250 pounds, and he didn't carry me right. I'm like, this is crazy, So I got rid of him, and the guy that replaced him, like 6'2", got muscles on top of muscles. He could probably carry me all the way to the office if I had him, and it's working out great. So
Good.
that's kind of my ultimate. That's sort of the beginning to end of the book. Like for me, I don't think there's any right way or wrong way to do this.
Yeah.
I think that it's just you gotta figure out what's your style, what types of things that you need them to do. Like some people are like insanely obsessive compulsive about having their apartment or their house perfectly situated with everything, So you gotta ask questions that result in that type of candidate. If you need somebody that's, sort of free flowing and ready for an adventure, doing something different every day, that's a different type of candidate. It's not really one right way to do it. So one thing I did learn over the years is during the interview, I think I like to ask them, what do you do for a hobby? What do you do in your spare time? Because I do find that people that watch sports are different than people who play sports. Or people who like to cook, they're kind of physical with their hands. So if they're physical with their hands in the kitchen, when it comes to dealing with my church and with positioning me perfectly in the chair, somebody who's athletic has better body mechanics than somebody who just sits in front of the TV. So that's one trick I do find that's an important thing. Yeah, ask what they do in their spare time. You get some interesting answers, and you just get them talking.
Do any of you use contracts once you hire in terms of commitments or processes for, quitting or things like that?
I do. I have a lot of policies that I have in place for my PAs. I have an attendance policy, a sickness policy, because I don't want them bringing sickness into my home.
Right.
And I have a cell phone policy. I have a few different ones that I ask them to agree to and sign when they first begin working.
Yeah. Did they ever, are they ever turned off by that, or are they ever dissuaded to keep going because of those?
I've never had a problem with it. I explain that it's a requirement. Everybody seemed pretty open to it.
Interesting.
What do you do if they don't adhere to the policies even after they've signed and agreed to them? I mean, do you have written in there, you can do this X number of times and then it's grounds for termination, or how do you handle that?
That's a good question. I have had to deal with that before. And usually if I have a PA that's not abiding by my policies or something like that, I'll do a performance evaluation with them, and I'll go over the things that they're doing really well, and then I'll mention some things that I would like to see them do differently. And if they're violating a couple of my policies, then I'll bring that up and I'll say, we discussed this when you started working for me, and you signed off on it, that you agreed to it. So I would like to see that behavior change in the future. And then I give them maybe 2 or 3 chances, and if they keep screwing up, then I'll seriously consider termination.
Yeah.
Yeah.
Yep.
Well, hey everybody, I'm going to take off, but it was great to hear everybody's thoughts, and thank you so much for setting this up, Dom, and whoever else was part of that. Thank you, everybody.
Thanks for coming, man.
Okay, I'll be back sometime.
Great, awesome. Take
All right,
care.
bye-bye.
I have another question, if it's okay for me to ask. TK, you mentioned that you have your caregivers lift you, and I have that same issue. I, like you, work full time, and being a girl, I pretty much have to transfer onto the toilet, and I'm certainly looking into Hoyer lift, or whatever brand it happens to be. That's something I'm exploring. But because I work full time and I'm in, I'm not just at my office. I mean, I have to travel some with my job, and I'm at the state capitol doing legislative work, and I have to go to old buildings like that. The bathrooms are terrible in terms of space. But one of the issues I have is caregivers not wanting to lift me, and I don't weigh much more than you, TK, but I just wonder sort of, what other people do in those situations. Because I work, I mean, even if I find a lift that works for me in maybe a home environment, I'm not really sure how it would work in my work environment, just because of the space and bathroom. But if any of y'all have that issue with, if any of y'all use public bathrooms where you have to transfer onto the toilet, that's, I guess, one question. And just how you overcome the issue of caregivers not wanting to lift you.
I can tell you, I recently posted in another group about one of the Hoyer lifts I have, and that Hoyer lift is it folds up so I can take it with me wherever I go. It's the Hoyer Advanced Patient Lift, and that's how I'm able to travel. because I can't be lifted at all. But that is one solution that if you do have a car that you go in to go to work, that might be a solution. Or
I
having,
do.
yeah. So
So it fits in the public stall type bathroom?
it would what? It would be if you had a wheelchair accessible stall, it should be able to easily fit in there. So
And I mean, and I guess, are you able to go from a sitting position in your chair to a sitting position on the toilet and meanwhile have your clothes adjusted and all that using the Hoyer lift?
when I sat up to go to the bathroom, right now I have problems with my hips, but when I sat up to go to that bathroom, yes, I did. Are you able to lean forward at all with help if someone holds you in the front?
Yeah, I mean, to a certain extent. I also have chronic pain issues with my hips, but yes, I am able to lean forward to some extent, yes.
As long as you can lean forward a little bit, they should be able to. And see, when I would lean forward, the Hoyer would hold me in place, but you can get a sling that goes under your legs, but the back side, from a little bit above your rear end to like the mid part of your legs is open, and they're able to pull down your pants and pull them up that way, and you're still sitting up and you're transferred from one to the other. That's how I did it when I was in college.
Okay.
But I'm also too big to be lifted, so.
Yeah, I haven't really had a problem. My guys can just pick me up and just move me around. But, in terms of going to the bathroom at work, it's easier for guys. So I love my external plumbing, and it works good.
Right.
And I live close enough to my house that if I had an emergency, I could be home in 15 minutes.
Yeah, welcome to rural Georgia. I live about an hour and a half with traffic from my job.
Wow.
Yeah.
That's rough.
Yeah.
Would you ever consider moving closer to your job?
Yeah, it's the systems in Georgia, unfortunately, which is one reason I do public policy. But the short answer is, I even though I have personal attendant care, I don't have adequate support that I would need to be able to live independently. So that's the short answer.
Mm-hmm.
So I live, with my family who provides additional supports beyond the paid caregivers.
I get it. I get it. In there. Yep. In there. Yep.
Yeah, but I mean, in terms of, I wish I could, because just the convenience alone. But we have a lot of work to do still in Georgia, don't we, Maria?
Yeah, we do.
I think this really opens up a bigger dialogue in terms of advocating. I mean, everybody here has the same problems. Our PCAs are not paid enough. We don't have enough hours, or if we do, we have trouble finding people for all the hours because of how little they get paid. So I think that we really kind of need to team up and make this a federal issue where TK said that we can transfer from state to state. Ideally, we would need something that would give us the amount of hours we need to be independent, would pay our PCAs a living wage, something that allows them to live and keep employment. And it's also it's also hard work. I mean, they're physically lifting and physically moving us. So they need health care to maintain their health. They need to be in good health so they can. They're in. They're in charge. We put them in charge of another living human being, and it just boggles my mind that these states don't think that the people in charge of other human beings taking like physical care, physical charge of them, that the states don't think that they deserve health care except for New York, which is the only state I know of that has that. And also, I think that we really, really need to be fighting for all of these
What?
things together.
It's not all. I mean, it's not everywhere in New York State. Um, my company, Concept of Independence, we provide it. Have you live out in Albany?
What?
I was asking Margie whether the company she works with has health insurance for her PAs.
They can buy it. It's not given to them free. They can buy into the program.
Okay.
Health and dental.
Is it affordable?
It's really not, and I don't know anybody that's using it.
That's ridiculous. That's absolutely uncalled for. And I'm not just calling out New York. It's ridiculous that in Ohio they don't do it, and in Georgia they don't do it, and Oregon, and wherever else we live. You know?
Yeah. I have both nurses and PCAs, and neither one of them get health care. So, yeah.
And you said they're through an agency, Joey?
Yeah, unfortunately, I want to do consumer directed, but I've been told that since I have nursing hours too, that it kind of complicates things, but I don't know.
Where do you live, Joey?
Kansas, unfortunately.
In Kansas, your personal assistants aren't allowed to do nursing tasks?
And they do, they're allowed to, but for me to get 24-hour care, I get 12 for a PCA, 12 hours a day, and then 12 hours for a nurse a day. That's basically the only way I can get 24-hour care, so.
So
Is
if
it
you,
all through the same program? The 12 hours of nursing and 12 hours of PCA, I mean, is it through, I don't know if it's a Medicaid waiver or what it's called.
It's through a developmental disability Medicaid waiver. It's through two different parts of it, but it's the same program. Like the home-based community services is my PCA hours, and the nursing hours is a separate part of it. It's kind of confusing.
and do you use the nursing services during the night or the day?
Yeah, during the night.
Okay.
And is that paid at a higher pay rate because of it being?
Yeah, they get paid about 18 an hour. I know the agency they use gets reimbursed like $28 an hour, but they keep a lot of it.
Wow.
Yeah.
And do you know the pay rate or the reimbursement rate for the personal assistance level of care?
I know hang on, Ron, how much do you make? Is it $9.24? How much do you make? Is it $9.24 or something? Okay. Yeah, it's around $9. I'm not sure what the agency gets paid from the state. I know they keep a few dollars an hour, but
Yeah, in Georgia, for the waiver that I'm on, it's called the Independent Care Waiver, and there's level 1, 2, and 3 level of support. To get level 3, you have to have, a ventilator or other things. It's called the hospital level care. But for level 1 support, the reimbursement rate is only $10.38 per hour. So that translates into most caregivers getting anywhere in the neighborhood of $8 to $9 an hour on average.
Yeah, here in Ohio, it's ridiculous because if you have a ventilator, you automatically don't get PCA care. You have to get, if say you get 24 hours care, you have to get all 24 hours of nursing care. And a lot of people are like, well, I don't need nursing the whole time, but the state won't listen, and it would save them a lot of money, to not have to pay nursing 24/7 for some of the people that have this.
Even if here in New York State, under the Consumer Directive Program, there's a special exemption to the Nurse Practices Act, which allows personal assistants to basically do everything that a nurse can do.
Yeah.
So, is there something like that in Kansas?
I'm gonna check into that, but I like having the nursing because the couple nurses that I have, they actually care. They do a good job with the trach and all that stuff, and some of the PCA, I don't really let the PCAs mess with the trach unless it's like an emergency that I have to change it, when they're here and stuff.
Yeah.
Because I've had bad experiences with PCAs not putting the trach in right, or putting it in too far, or just
Yeah, my track is so old that the track is really, 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 really well established. So it's not a problem for me.
Yeah.
This is a good reason to get a trach. If you get a trach, you get more care. I think we should tell people, everybody go out and get a trach.
Or get asthma. They can't leave me alone because I have asthma attacks. So I get a lot more care because I can't be left alone because, I can't anticipate when I would have an asthma attack, and I don't have enough strength to press my medicine. So.
Okay, asthma or a trach. That'll help you out. So there you go. That's why Joey got his trach.
Yeah, it is. No, but that's the only reason why I get 24-hour care, though.
Right.
If you're
any other questions? Yeah, go ahead.
I was just gonna say, if you're an overachiever, you can be an asthmatic who has a trach. So.
So this is interesting because in Georgia, unfortunately, there is no such thing as 24-hour care unless you're in an institutional setting, and that's not really 24-hour care either, really. Don't get me started on the whole institutional bias in this country. But so I want to make sure. So I'm hearing that in New York, Kansas, and where was the other place? Is 24-hour care in the community even a possibility? I mean, it's
Yes.
mind-boggling to me being in Georgia where that's just like not even.
In Ohio.
Yeah. I'm in California. I got 23.5 hours. I don't need nursing either on a Medicaid waiver.
By the way, what's your name?
My name?
Yeah.
Eric.
Okay, I didn't see. Okay, now I see your name. All right, good. Thanks for joining us, Aaron.
Hi, Eric.
Hi.
Yeah,
in New York,
Okay.
it kind of depends on where you are. In New York City, 24-hour care is certainly available, but in upstate parts of the state, the local counties that administer the program, they don't authorize it that often. So it's harder to get in upstate New York. Not impossible, but it's less common.
Well, in Kansas, it's getting harder to get because the whole Medicaid privatization here, and it's just a whole mess here. It's just getting worse every day too.
Mm-hmm.
I've had 2 evaluations in the past 6 months for my hours.
2.
Yeah,
Oh.
just ridiculous.
I have 13 hours a day through Medicaid waiver, and then I get 5 hours additionally through a BVR program where the precedence is for people that are in school or who are working, but they will give anyone it. And I get 35 hours a week, so 5 hours a day. So that really kind of helps supplement the extra hours I have, and then so I get 18 hours total, and then after that, I'm mainly asleep. So. Does anybody else?
Done. You have to move to New York. I think everybody should move to New York State.
I think if we could just fix that, crossing the state lines thing, because it's just like it's something else. I mean, it's an uphill battle. I know for all of us, we face to a certain extent in each state. It's kind of, frankly, it's disheartening to me that Georgia being the the origin of the Olmsted case, and then we're so behind.
Right. Mm-hmm.
Kansas is moving backwards in that direction.
Yeah, Ohio is a mess right now, and the sooner we can get to New York, the better. It's gonna happen in the next couple months, Certainly by spring we'll be in New York, but it's just like a countdown because it's a mess here. With that, they basically what they did is they privatized anybody who got Medicare, Medicaid, and that means our Medicaid waiver is also through privatized insurance. Well, they rolled it all out in 3 months, 115,000 people, and they didn't have the staff to support the rollout. So now my PCAs haven't been paid for 7 weeks, and in some parts of the state, people haven't been paid since May. So a lot of PCAs are getting to the point where they're going to have to get other jobs to feed themselves and feed their kids. Some people in Cincinnati have their power's going to be shut off, and Ash actually got a call from someone today, and they informed her, well, you might get paid today, maybe, or you might get paid this week, maybe. And we strive to pay everyone every week, but, that doesn't always happen. I'm like, oh, that sounds promising, thank you. Thank you, State of Ohio, for privatizing. But, it's been the plan. I mean, this was the big fear when Romney talked about wanting to privatize insurance is that, these private insurances aren't regulated by the state in the same way. And so they can really get away with doing whatever they want. Like the state of Ohio keeps putting their hands up right now and they're saying, oh, we can't, it's not us, we send it to Buckeye, And Buckeye says, well, they didn't give us time to roll it out. So, nobody wants to take blame.
Yeah.
So in Ohio, is there a what they call a fiscal intermediary, or does every PA serve as like a private contractor that gets paid directly by the insurance company?
Yeah, they're contract. Well, I do consumer directed, which means I hire people. They don't call it consumer directed, but that's what it is. I seek out and hire my own people. I do the advertising, the training, everything, and then they bill the insurance.
Who cuts the check to Ash? Is she paid by The next,
Buckeye has a problem. Buckeye has a service. She used to do something called Rhino Bill, and Rhino Bill would address the state and kind of act like a fiscal intermediary. But now she has to go through Buckeye's system. So, and Buckeye's the insurance company.
so Buckeye, which is the insurance company, pays Ash.
Yes.
Okay. I would think you should contact your local legal services office.
Yeah.
Because on so many ways, this sounds really kind of illegal.
Yeah.
And from a labor point of view, you know, not paying your workers is
Oh yeah. I got a call from Sherrod Brown. Sherrod Brown contacted my state. Sherrod Brown, for people that don't know, he's my my senator in Washington for Ohio, and he is the only politician who has gotten back to me. I've called every politician, and rep, minus my state reps, and Sherrod Brown contacted my state rep, and her office called me today, and they said they've gotten so many complaints, so they're working on it, and they were just like boggled by the fact that people were told Ash, oh, we don't pay, we might pay you once a week, like when we're supposed to, but that doesn't always happen. Well, yeah, it hasn't happened for the last 7 weeks, Of course it doesn't happen, you stupid insurance company, But,
Whatever.
No, like another thing you could try is every federal agency, you can file a civil rights complaint. So you can go to the Health and Human Services, like CMS website, and get the an OCR, Office of Civil Rights complaint form.
okay.
And basically, you could allege that due to Buckeye's failure to pay your BAs, that your homestead rights are in jeopardy,
Yeah.
and you can file an homestead OCR complaint regarding the lack of payment to your workers.
Okay.
I think the more things you can do to get on the wrong, to piss off, to get, under Buckeye's skin, I think it would be good for you.
I
Because
did.
they don't want they don't want the federal government stepping in and doing audits and everything like that.